nclex questions on mental health with answers. 1. The nurse is reviewing the chart of a client who was recently diagnosed with schizophrenia following graduation from college and notices that the date coincides with the date of the client's mother's diagnosis of schizophrenia. The nurse evaluates the major risk factor contributing to the development of schizophrenia in this client as A. A recent search for employment. B. Being from a low socioeconomic class. C. The mother's genetics at the time of diagnosis. D. Recently divorced. One. A client who belongs to a familiar religious sect reports seeing visions. Neither the client nor the family are concerned. The nurse understands that. Which of the following explanations accounts for the lack of concern about this visualization? A. The client is not convinced of the religious sect. B. The family believes that the client made it up. C. Cultural variations of spiritual beliefs exist. D. This is the first time visions have been seen. Three. The nurse working in an adult inpatient psychiatric unit is admitting a client recently diagnosed with schizophrenia. The nurse notices that this client is constantly drinking water. Which of the following interventions is a priority for this client? A. Monitor intake and output. B. Obtain serum sodium and potassium levels. C. Restrict the client's oral intake. D. Educate the client about a low sodium diet. 4. The registered nurse on a psychiatric unit is making clinical assignments. Which of the following assignments should the nurse delegate to a licensed practical nurse? A. Plan the medication schedule for a client with schizophrenia. B. Instruct a client with schizophrenia on the anxiolytic. C. Document the description of the hallucination a client is experiencing. D. Discuss with a client's family the treatment plan for the client. Five. A client is admitted to a medical surgical unit with an infection of the right great toe and temperature of 38.9 degrees C, 102 F. The client appears to be becoming psychotic. In determining what action to next, which of the following factors should the nurse consider? A. The client is having an acute onset of dementia. B. The client was postictal. C. The client's circadian rhythm is unsynchronized. D. The client is psychotic because of the infection. Six. A client with a bipolar disorder is brought to the emergency department by the spouse after the client pointed a steak knife at the spouse and yelled, "I know that. You jealous of my special gift from God?" The nurse informs the spouse that this behavior is most likely explained by which of the following? The client. A. Cannot handle the marital discord. B. Is becoming demented. C. Became psychotic during a manic phase. D. Wants to kill the spouse. 7. The wife of a client with paranoid personality disorder asks the nurse why the client keeps blaming her for plotting against him. Which of the following is the appropriate response? By the nurse. A client with paranoid personality disorder. A suspects others' motives. B prefers solitary activities. C lacks interests or hobbies. D is emotionally detached. Eight. A client diagnosed with paranoid personality disorder has been hospitalized because of his suspicious and threats towards the company boss. While in the hospital, the client continues to be suspicious of the nursing staff. The primary goal for this client would be which of the following? A. Inform the client that the boss has no harmful intentions. B. Promote the development of trust with the nursing staff. C. Educate the client about the legal risks of harming the boss. D. Convince the client of the true motives of the nurses. Nine. Two staff members are talking and laughing about their weekend activities in the hall outside the room of the client diagnosed with paranoid personality. The client appears annoyed and is suspicious of them while they are talking. Which of the following is the most appropriate intervention? A. Encourage the client to engage in the conversation. B. Report the staff members' inappropriate behavior. C. Inform the staff members that the talking can be misinterpreted as secretiveness. D. Close the door to the client's room. 10. An important role of the nurse is to facilitate social interaction between a client who is paranoid and others. The nurse implements these interventions based on the understanding that a client with paranoid personality disorder A is outgoing in socialization style. B tends to exhibit loose boundaries when sharing feelings. C likes to be around large group of people. D tends to be isolated and lacks social skills. (11) When planning the care of a client who is paranoid, the nurse should include which of the following interventions to increase the sense of trust? A. Give the client the nurse's home phone number for support. B. Spend more time with this client than the other clients. C. Solicit the client's participation in the department of the treatment plan. D. Fulfill all the client's requests to provide assurance of active listening. (13) Which of the following interventions will be most appropriate for the nurse to implement for a client in a paranoid state who is having difficulties falling asleep and has tried reading, taking a warm bath, and drinking warm milk, all of which has been successful? A. Instruct the client to try all of these again but for a longer time. B. Administer a prescribed drug for relaxation. C. Offer the client a back rub. D. Encourage the client to listen to the radio. (13) Which of the following does the nurse evaluates as a disturbance in the activities of daily living for a client who Is paranoid. The client A goes to the grocery store only when more food is needed. B signs up for the meal on wheel service. C refused to eat any food item that is not packaged and can be self-opened. D goes over to the neighbor's house for dinner once a week on Friday evenings. A client experiencing paranoid behavior believes that the drugs are poisonous and doesn't want to take them. Which of the following nursing interventions should the nurse include in this client's plan of care? A. Administer the drugs intravenously if the client refuses to take them orally. B. Tell the client that taking the drugs are a part of the treatment. C. Restrict the client to the room until the client agrees to take the drug. D. Inform the client that the doctor ordered the drugs and they are necessary.